My name is Christopher Hess. I'm one of the movement disorders neurologists here. So thank you all for joining us today, and thank you to Dr. Dorsey for a really thought-provoking talk. So we're going to be changing gears a little bit now and focusing on communicating with your doctor and making the most of your clinical visit. It's going to be about a half an hour, and I'm going to be talking with you about some tips and tricks and ways to approach the process of seeing your doctor regularly. Okay, so this is a cartoon that was made by one of our prior movement disorders fellows based on a conversation and an analogy I often have with my patients. And so I'll often talk to patients and say, we're all on our journey, right? We're all on our journey through life. On that journey, sometimes you get surprised by the roads that you take. Sometimes you know exactly where you're going. You have friends and family in the car on the journey with you. And when you get diagnosed with Parkinson's disease, you often find that you have this unwanted passenger with you, right? They're going to be with you for the rest of the journey. Right now, we don't have a cure for Parkinson's disease. We don't have a way to reverse it. And so you have this unwanted passenger, and you can, sometimes when you're having a tough time, they are right up there in the front seat next to you. And other times when things are sort of average, they're in the back seat. And sometimes when things are going really well, they're in the trunk and they're knocking for your attention, right? But for the most part, it varies. And so your job as a patient with Parkinson's disease, and our job as well, is to make sure that Parkinson's is not in the driver's seat. And that's really going to be a focus of my talk today, specifically with regard to making the most of your visits with your doctor, because it's a very valuable time. Okay, so I'm not going to spend too much time on finding care, but everybody in the room is somewhat lucky in that they are within driving distance of a major movement disorder center. Throughout the United States, that is not the case. So about 40% of patients with Parkinson's disease throughout the United States are getting their Parkinson's disease care from their primary care doctor. And we know from studies that that is not ideal. Only about 10% of patients across the United States are getting their movement disorders care from a movement disorders expert, right? So we're all movement disorders neurologists. This is all we do. General neurologists, they have to treat epilepsy, they have to treat MS, they have to be sort of a jack of all trades. We have the luxury of focusing just on you. And so it's the minority of patients who have the luxury of being able to be seen by a movement disorders neurologist. And there's a lot of people that are tuning in remotely from across the US today. And the information I wanted to convey to them was, if it is at all possible, you definitely want to try to get your movement disorders care from a neurologist. If you're able to get access to a movement disorders neurologist, that's terrific. Again, only 10% of patients are able to. There's not that many of us out there. And so if you are getting your care from a primary care doctor, you might have a great primary care doctor, but they have to be good in everything, and they have to know who to send you to and when to send you. And so it's really important to try to, at a minimum, get your care from a neurologist. And if you have access to a movement disorders neurologist, that's terrific. Does anybody want to guess? Every year we have our graduating fellows, so we have a large movement disorders program here. Does anybody want to guess how many newly minted movement disorders neurologists were sent out into the world last June? Okay, so I heard a whole bunch that ranged from 170 to 1, so 67. 67 movement disorders neurologists graduated last year for the entire United States. And that's actually better than a decade before that, when it was in the 30s. So again, really a luxury to be able to be seen by a movement disorders neurologist. And if you have access to that, you want to really make the most of your visit, because that's your time. And one of the best ways that you can stay in the driver's seat with regard to your life is to stay in the driver's seat with regard to getting your Parkinson's care. Okay, so now we're going to move into some tips, right? So we have our Boy Scout on the side here. His motto is be prepared, right? Be prepared, and then we've got Mike Tyson on the other side, and his famous quote was, everybody has a plan until they get punched in the face, right? But nobody's going to be punching you in the face at your visit, so you don't have to worry about that. Your plan that you put together ahead of time will be valid, right? So when you go to your movement disorders visit, you think to yourself, okay, I'm going here because they're going to monitor my symptoms, or I'm going because they're going to fix my problem. And all those things are things that we try to do throughout your movement disorders visit. But what you're really doing is you're going there for a fixed period of the expert's undivided attention. And if you're at a center like ours, that can be for a half an hour for a follow-up patient and for an hour for a new patient. And if you're in a private practice, sometimes that's only 10 or 15 minutes. But it's very, very valuable time. And what you want to do is you want to make it as easy as possible for the person providing your care to make decisions in that fixed period of time, right? So any deviations from the ideal with regard to transmitting information back and forth, with regard to preparedness, is going to take away from the time that we can spend coming up with a plan to improve your lives. And that's what we want to do, right? If we could clone us and send each one of us into each one of your houses, we could manage your Parkinson's very well. But obviously that's not possible. And so it's very, very important to think of your visits that way. You want to think of it as, how can I maximally allow my provider to help me during that visit? And it's all about preparation and having a plan. So one of the most important things that you can do is bring your partner. Sometimes patients will prefer to have their partner wait in the waiting room, and there are personal reasons for why that might be. But for those of you who do have your partner with you in your clinical visits, there's a tremendous benefit to that. And it's for a couple of reasons, right? So one is, you don't remember everything that's been happening to you. You don't remember everything that's happened over the course of the time since the last time you were there. They are another source of information that you can lean on when you're not quite sure of an answer. For many of you, your partner is the pharmacist. They run the medications, right? You're just following the plan. So having them with you allows access for the provider to know exactly what you're doing. And also they see a different aspect of your Parkinson's disease than you do. So when you're caring for someone with Parkinson's disease, you have a lot of experts. You have the patient who's actually an expert in what they're feeling. They're going to know what they're feeling to a much better degree than I ever will. And their partner or their family member is looking at it from the outside, and they're seeing things that I'm not seeing and that the patient isn't seeing, or that you're not seeing. And so everybody brings this area of expertise, and it's really, really important to make use of that, because it can be very valuable to have your partner's input. So I always recommend bringing your partner with you. Okay, managing your own medical records. So there's a very famous quote by Ben Franklin that says, "In this world, nothing can be said to be certain except death, taxes, and your doctor's office misplacing your medical records." So I might have changed that quote a little bit, but the point here is that there are thousands of records going back and forth in doctors' offices, right? Every day, faxes are coming in, records are going out. There's only one of you. And in an ideal world, you should be able to sit back and not have to worry about the records, and it would always get to where it's supposed to go, but it just isn't reality now. So what I recommend that all of you do, if you're seeing a new doctor, you want to make sure that you go to that physician with a copy of your own medical records. So it's great to have a doctor and say, please send my records to X place, right? And then you've got a chance of them losing it when they send it, you've got a chance of them losing it or misplacing it when they receive it, or you've got a chance of it being there, but just in a pile of other records that just haven't been processed yet. If you get your own records and you bring them to an office and you say, here are my records, copy them please, but then give them back to me, you maintain control over that data, and you can bring it to any doctor that you want. And it's the same thing with any imaging studies that you get done. So if a primary care doctor or a private neurologist in the community orders an MRI of your brain, they are going to get back a report that describes what the radiologist thinks. When we order a study, we care what the radiologist thinks, but we want to see those images ourselves. And so whenever you get a study done, I always recommend getting your own copy of the disc, right? And when you do that, you can bring that disc to us and you can say, here's my MRI. Make a copy of it, but then give it back to me. And you always maintain control of your own medical records. This is a way to make sure that when it comes to your own care, you are staying in the driver's seat. Okay, so this is kind of a joke, obviously. We are very embarrassed by how often we run late, but it is really important to plan ahead because we all know getting out of the house when you have Parkinson's disease can be difficult. You never know if there's going to be a bathroom issue. If there's even a little bit of traffic, it's going to worsen your Parkinson's symptoms as you stress about it. And if you are even 3 minutes late for a 30-minute appointment, you've lost 10% of your time, right? So you bring a book, bring an iPad, bring something and leave early enough to where during that 30-minute period of time, I'm going to do everything I possibly can to help you within that period of time. And if I can go over a little bit, I will, and sometimes that's why we're late. But in the end, it's going to be up to you to make sure that you're making use of that full amount of time. So it's really, really important for you to be there on time, and we do the best that we can to try to start on time. Now, that being said, a lot of you have had that experience of being in the waiting room and waiting and waiting and waiting. And so as you can imagine, life happens to people, right? So if we are seeing patients and each patient each day takes 6 minutes to either get in the room or there's a delay or someone has to use the restroom, you take that 6 minutes and you multiply it by 12. And you can imagine if you're the last patient of the day, how far we are running behind. Not because we came late, not because we stopped for a coffee or something, just because we're doing the best that we can to keep up. And so every time we come in the room and we're 30 minutes late or 45 minutes late or even sometimes an hour late, we're mortified and we're embarrassed and we wish that wasn't the case. We respect your time, but we're doing the best we can, and the only thing that I can say in those situations is just try to keep in mind, if we find a situation where you're the person who needs that extra time, we will give it to you the same way that someone before you might have needed that extra time. Show your hand. Okay, so if you see your provider for Parkinson's disease, and you have a form for them to complete, or you have paperwork that you've completed, or maybe you're involved in a research project and you have completed a questionnaire, or maybe you have new records that need to be added to your medical record at that center. You don't want to wait to the last 5 minutes, right? If a doctor, so when we come in the room, it's almost like a battle plan. We know what the issues were with you the last time we saw you. We know what we expect the issues to be. And as we're going, we're strategizing, how much time can I spend on this? How much time can I spend on that? Because all of us know that we would need to be with you for 2 hours to address all of the issues that you have, but we've only got a half an hour. And so if, as I'm telling you, can't wait to see you next time, enjoy your cruise that you have coming up, if you pull out something like a paper or a form or something to complete, it's very, very difficult for me to do that at that time. So if you have a plan of what you want to talk about, if you have paperwork to complete, anything that you have that you brought with you that is of importance, show your hand at the beginning of the visit, and we can incorporate that into the entire visit. We'll plan our time based around that. So really, really important for you to do. Bringing an updated medication list. So I know that many of you are on multiple medications, and I know how difficult it is to keep track of them. I take a medication for reflux. I can't remember to take it probably 40–50% of the days, right? But when you have Parkinson's disease, you don't have the luxury of not being able to stick with your medication regimen. And if you come to see us and you're not exactly sure of what medications you're on, we can't make an intelligent choice to help you, right? We have to know exactly what you're on at any time in order to make a choice that, one, we know isn't going to interact with something else, and two, to know that we're not adding a medicine that is superseded by a different medication. So if you're showing up to your doctor's office and you don't know what's on your medication list, there's no way that you're in the driver's seat. There's no way that you're making the best use of that time. So bring an updated medication list, which is great for you to have regardless, right? Because you never know when you could find yourself having to get admitted to the hospital or someone calls 911. If you have that list on you, it's got your allergies, it's got your medications, it's got your general past medical history. You just hand that to the EMT, and it's a way to keep yourself in the driver's seat. If there's any doubt, bring your bag of medicines. Just bring the whole bag. We can scan through that list of medications very, very quickly. If you're not quite sure what you're supposed to be taking, bring the bag, because what you're prescribed doesn't always match what you're actually taking on a day-to-day basis. So bring your medications or bring the actual bag of medications themselves. Okay, so Yoda says to focus you must, to stay focused, right? So all of us in our normal conversations, we talk to people about things, we bring up different topics, the topics meander around, sometimes someone will bring one thing up and it'll make you think of something else. This is the way people communicate, and it's normal, and we all do it. But when you're in your doctor's visit, remember, staying in the driver's seat means staying laser focused on what you want out of that visit and on answering the questions that your provider has. So if we ask you something specific, you gotta really pay attention in a different way than you would normally pay attention in a conversation, because the sooner I can get through the things that I know that I wanna ask you, that I need to know, the sooner we can get to the things that you're concerned about, and the sooner that we can actually have time to maybe address things that we hadn't in the previous visits had time to address. Because as we said, I never finish a visit with a patient knowing that we covered everything that we need to cover. So stay focused like Yoda. Okay, Honest Abe, be honest, right? So I know that for many patients, you don't want to go to the doctor. You're doing the best you can of taking your medications on time. You're doing the best that you can of remembering to take it. You don't want to hear us belly aching at you about why aren't you taking this or why aren't you doing this better. We understand that it's difficult, right? We know how difficult it is. The more honest that you are with us, you might have to hear a little bit more of us encouraging, to put it in a nice way, of the best way to do things. But that's what's going to help you the best, because if you're telling me I take my medication 4 times a day as prescribed, I'm going to make a particular change if you don't look very good, if you look like your motor symptoms are not controlled. But maybe you're only taking it twice a day because you can't remember to take it on it's that second afternoon dose that's so difficult to remember to take, right? So I could be giving you the wrong medication or developing the wrong approach if you're not being honest. And the same thing with exercise. When we're asking you about exercise, we want to know what you're actually doing, not what you're planning to do, because I know myself, what I actually do for exercise and what I plan to do are 2 very, very different things. So it's far better to be honest and to let us work through a plan, even if that plan means, look, what the ideal is for exercise or for medication administration, it's just not going to happen. So we've got to come up with another plan. There are things that we should be asking you that we can't always find time to. So sexual side effects is one of those. So if we do ask you about that, again, be honest, we're there for you. And the same thing with anxiety and depression. We're going to talk a little bit more about apathy later, but a lot of times patients see themselves as, I'm not the type of person who would ever be anxious or depressed. But once you have Parkinson's disease, this is a symptom of the disease, the same as tremor, the same as stiffness and slowness that goes along with the disease. So be honest when it comes to depression and anxiety, and especially think about, I can't tell you how many times I see patients where they seem to be describing a situation where anxiety and depression are really significant in their life, but they don't consider it that way. So when you're thinking about depression, anxiety, think about how much does this affect my quality of life on a day-to-day basis, because half the time that I see patients, I am adjusting their medications for their motor symptoms, but the thing that is affecting their quality of life the most on a day-to-day basis is not their motor symptoms, it's depression or anxiety. Okay, so it's all in the patterns, right? We ask you all these different questions here, questions there. What time are you waking up? What time are you going to bed? What time you take your medicine? What time does it wear off? But a lot of these questions are the same. Right? So for many of you, I'm doing the movement disorders exam with you, and you're starting to do the next part of the exam before I even start it, because you're an expert at getting the exam done on you, right? And so it's the same thing. You know some of the questions we're going to ask you. You know we're going to ask you about how long does it take to kick in? How long does it take before it wears off? You know we're going to ask you about constipation. So these are all things that you can think about either on the drive-in or the day before, because the earlier you think about it, the more complete of an answer that you can give us, and you don't have to worry about thinking about it in real time. Take notes. Okay, super important to make sure that you're taking notes. Nobody remembers what the doctor says when they leave the office. It's like you remember the question that you wanted to ask on the drive home, and whatever we say is going to be pretty much gone out of your memory within a day or two. So if you have a partner with you, they can be the note keeper and you can focus on what we're saying, or sometimes you're the note keeper. But taking notes can sometimes, even if it's just small things, can sometimes help you to make sure that the most critical things that are being conveyed to you or that you're conveying are actually remembered and are actually followed through. Because remember, we're taking notes of everything you say. And so when you come back, we know what happened last time. So you should be taking notes too in order to stay in the driver's seat. So this is one that comes up a lot, right? So I will say to a patient, did you ever try amantadine? And I can tell just by looking at them, they're thinking, you've got my entire medical record in front of you. I've tried 20 medicines in the past 3 years. Why are you asking me if I tried amantadine? Just look it up. And the reason we do that, usually when we're asking, we're already in the process of looking up. But the reason that we do that is, again, we've got our fixed 30 minutes of time. And if you could tell me off the top of your head, oh yeah, I was on it, it was 2 years ago, great. We can lock in on that time period and we can figure out, okay, did you not tolerate it? Did we prescribe it and then you read the package insert and you got nervous or did never take it? So it's not that we are sort of putting that onus on you, it's that we're just trying to be as efficient as possible. We know that it's difficult for you to remember those things. We appreciate the effort that you're just trying to put in to remember them. But that's why we do it, because we're trying to make the best use of that time, which is really your time. Nobody remembers everything that we ask you. When you go to see your neurologist, very often it's question after question after question, and you get overwhelmed because you don't remember. And it's okay. We don't expect you to remember everything. We're expecting that a good portion of all the questions that we ask you, you're not going to have an answer for, and that's okay. So don't let it fluster you. Stay on course, stay on track. Know that we're expecting that, and we will work in the best we'll do the best that we can in the situation, because nobody is expected to remember all the details that we would ask you related to your care and related to your history. This is also one that comes up a lot. So nobody's putting on a show, and I'll tell you what I mean by this. Does anybody recognize these gentlemen here? Okay, so we got Frank Sinatra, Dean Martin, Sammy Davis Jr. Those are the easy ones. Who are the guys on the other end? Peter Lawford, right, who was famous because his sister was married to JFK, and then Joey Bishop, who actually was a pretty good comedian. And they used to put on this amazing show as the Rat Pack in Las Vegas. And sometimes if you are the caregiver of a patient with Parkinson's disease, you will see that your spouse will be barely able to walk, or they'll be freezing left and right. And then suddenly they get in the doctor's office and they're walking like a champ. And you're wondering, like, what's going on? This isn't the way you walk at home. This is not real. Like, why are you acting like this? Don't put it on. Show him what it's really like. And it's not that they're putting on a show. It's just the process of the disease. Being at the doctor's office is going to change what a person's symptoms look like. We know this. We expect this. Your tremor is going to be different at the doctor's office than it is at home. Your gait and your walking is going to be different. So if you're a caregiver and you feel like your spouse is putting on a show every time they go to the doctor's office, that's not what it is. We expect it to be different because the dopamine levels change based on the activity that you're engaged in. So does the type of exercise matter? So we could talk for hours about exercise and Parkinson's disease. The only reason I put this in is because I often have patients who tell me, I'm exercising. Okay, that's great. What do you do? I ride my bike, but they're not doing anything for their upper body. Or, okay, I'm exercising, I'm doing rock steady boxing, which is terrific, right? And then you're testing their fine dexterous movements, and it's terrible because they're not using their hands, they're not exercising and practicing individuating and making their fingers work together. So when you are doing exercise, staying in the driver's seat means working your entire body and making sure that exercise includes strength training, cardiovascular, and stretching. Stretching, super important. Another important one. So judging the value of activities, okay? So when you have Parkinson's disease, you will find that many of the things that you used to love to do are not going to be rewarding anymore. Your your body is not, you're going to feel like nothing's worth doing. Should we go visit our family member? Nope, I don't feel like it. Should I get up and exercise? Nope, I don't feel like it now. Should I go out to eat? Nope, not worth doing. Because the part of your brain that's involved in motor function and judging how fast to make a movement, how big to make a movement, is the same part of your brain that's involved in reward. And so nothing is going to feel like it used to be like it's worth doing. And so what you need to do is change that desire for a feeling to an intellectual thought. You're not going to get that feeling of reward. You're not going to get that feeling of, I want to go do this. You have to convert that hooked on a feeling. You guys remember this song? It came out in like 74. Nobody's ever heard of Blue Swede since then, right? It was just that one song. So you have to change that desire for the feeling of reward to an intellectual thought of reward, right? Because you're not going to get that feeling again. It's part of the disease. If you don't make that change, you're not going to be enjoying life the way that you could, and that's not being in the driver's seat. So irritability is one that comes up a lot, right? So irritability can come up in caregivers because it can be very, very difficult caring for someone with Parkinson's disease. And if you have Parkinson's disease and you are not moving the way you used to, and you're dealing with running to the restroom all the time, and you lash out, it's not going to be at me, who you see 3-4 times a year. It's going to be at your spouse, who you see every day. And so irritability is something that really comes up a lot, and it's something that, if it's a problem, bring it up. Talk to us about it, because there are things that we can do to help you both to work your way through it, and sometimes just bringing it up to the surface is really important. Levodopaphobia. Okay, so there's a lot of patients who, especially when they're early on and they are doing well, are terrified of increasing their medicines. It's almost like, okay, if I increase my medication, that's a failure. That means that something's going wrong. That means that I'm getting worse. And we know that the best care means we focus on best symptom control at any point in time. We don't want to give you more medicine than you need to, but there's no reason to withhold medication like people thought was a good idea to do 20, 30 years ago. So really, really important to not be afraid of dose increases when you need it, or going on carbidopa-levodopa when you need it, because it's going to help you. The goal is to improve your function on a day-to-day basis. And if you are afraid of it and you delay it beyond the time that you need it, you're going to suffer more than you need to. And the same thing with protein. So for whatever reason, of all the things that Parkinson's disease patients need to know, this is the one that gets to everybody. Protein, don't take protein. But there are very few patients, it's the minority of patients, who have any interaction with protein. So what everybody knows and what everybody hears is that protein blocks or interferes with the uptake of carbidopa-levodopa, which is totally true for many patients. But you can't go without protein. You can't stop taking in protein, or your muscles are going to end up, the protein's going to be taken from your muscles and you'll lose muscle mass. So the best way to approach protein is to just eat and take your doses. And if you see a correlation, a high protein meal, and then you're not getting as good of an on, that's a good reason to address it. But if you're not noticing that correlation, there's no need to be worried or afraid of protein. Okay, so does anybody remember this song? It's My Party, 63, right? So this was Leslie Gore, no relation to Al Gore, who invented the internet. So this is your party. If I have a plan for what the day is going to be like, for what that visit's going to be like, or even the day, because as we know at our Parkinson Center, you're there for a day or a couple of days sometimes. If I have a plan for what it's going to be, and that's not your plan, you're the driver, you're the one in charge, and you need to let me know, like, I understand that we need to talk about these things, but this is the thing that's most important to me, and this is what I want to prioritize, and that's what we will do. And we will always, we'll work with what's safe, but at the same time, you have to be in charge of making sure that you're getting your desires and your needs met. So teamwork makes the dream work. So at UF, we are very lucky. We have integrated physical therapy, occupational therapy, speech therapy, genetic counselors, social workers, psychiatrists, neuropsychologists. It's terrific. Outside of that type of setting, it's very, very difficult to get anyone to talk to each other, right? So Dr. Oken has said for many years now, the patient is the sun and we orbit around them. And when you come to UF, that's easy to do. I can walk down the hallway and talk to your physical therapist, or walk in the other direction and talk to Dr. Foote. But outside of that setting, it's very difficult for all those people to communicate. So putting together a care team is difficult. It's going to be difficult, expect it to be difficult, but it's important because the best care for Parkinson's disease is interdisciplinary care. A quick note about too many cooks in the kitchen. So many of you may have local neurologists who you see 2 times a year, 4 times a year, and you just check in with us once a year. And it works. And it works because there has to be the quarterback. There can only be one quarterback, right? So you can't have one person pulling in one direction, coming up with one plan, and then we're pulling in another direction, coming up with another plan. Now you can have 2 neurologists, a local neurologist and us. That's the hub and spoke model that Dr. Oken's been describing for decades, and it works. But there has to be one person making the changes. So either we can be the person making the recommendations and your local neurologist can make the changes, or we actually make the changes when we see you. But there has to be one quarterback. Otherwise, you're not going to be getting the best care because you're just going to be getting pulled in different directions. Any VA patients here in the crowd? I don't see any today, but we may have some VA patients connected remotely. If you are a VA patient and you're seeing an academic center or a private practice on fee basis, remember, don't give them your insurance cards because if you do, you're going to end up getting double billed, right? Because if you're getting fee basis care, when you walk in the door, they're going to do the same thing that they do with every patient. Can I see your insurance cards? But you don't want to give them your insurance cards. You want to say, I am here as a VA patient on a fee basis, because otherwise you could run into the problem of getting the double bill. Obviously, if you're a VA patient but you're using your Medicare, then you give your Medicare card. But just something to be aware of. If you are in the VA system, it's a lot more difficult to get prescriptions. They have to go to your primary care doctor, who then has to prescribe them. They have to be on formulary at the VA. So if you get community care and they recommend a medication, there's no guarantee that that medication is going to be actually available for you or that you'll meet the criteria for it in the VA system. And the same thing with therapy. At the Movement Disorder Center at UF, we have an amazing physical therapy group. I would love to send every veteran there. The VA is only going to send you there if they can't provide a service that the VA can provide locally, right? Because it's a cost issue. And the same thing with neuroimaging. It's difficult to do, so if you have the capability of getting imaging done at your movement disorders or at your neurologist's office, that's always the best because then we actually get to look at the pictures. It makes it as easy as possible. Okay, so don't improvise between visits. So who is this on the left? Miles Davis, that's easy. Who is it on the right? Dizzy Gillespie, cheeks, give it away. Who is it in the middle? No, not me. That's Bill Evans. So between visits, we give you a plan. You don't want to be improvising with regard to your medication regimen, okay? You want to follow the plan that we provide for you, because if you come back and you have done something that's different from what we recommended and it's different every day, we can't make an intelligent decision about what we recommend for you to do in the future. So if you have a concern and you want to make a change, just give us a call and run it by us. Now, I know that sometimes it can be difficult to get in touch with any doctor outside of your regular hours, but you have the portal, and at least at our center, we have our fellows who help with messages, and we will get back to you. Don't improvise like these gentlemen here, or it's not going to be being in the driver's seat. It's not going to give you the best care. How frequently you need to be seen. So this is different for every person. It's different in every practice. Sometimes you might see us once a year and you'll see your local neurologist more frequently. Sometimes it'll be as frequently as every 3 months. Sometimes you'll be doing great and you won't need to be seen very, very frequently. So it's going to be dependent on a lot of different factors, and it's really customized for each individual person. If I say to you, wow, you look like you're doing great, I'll see you in 9 months, and you tell me, I don't feel comfortable with 9 months, you have to tell us and let us know, and we'll talk it out, we'll figure out with a plan. Why do you not feel comfortable? Maybe we need to switch to 6 months, or maybe I just need to reassure you that we're good for 9 months. So it's different for every patient. If you have concerns too soon, not soon enough, just let us know. So I talked to you today about some ways that you can make sure that with regard to your Parkinson's care, you are staying in the driver's seat, because Parkinson's disease is now with you on this journey. We can't kick it out of the car, but the only thing that we can do is make sure it's not driving. So thank you all very much.